Welcome to your COVIDENCE UK update for September 2021. My name is Adrian Martineau and I'm the Chief Investigator based at Queen Mary, University of London. In today's webinar, I'd like to present to you results from final analysis of our pre-vaccination antibody study. So what can pre-vaccination antibody levels tell us? Well, broadly, they can tell us two things. First, if we look at positive versus negative results, this will tell us whether or not someone is likely to have had infection with SARS-CoV-2, the coronavirus that causes COVID-19, irrespective of whether or not they've had any symptoms. A second piece of information that antibody results can tell us is if they're positive, then the levels can indicate the strength of the immune response. So, what are the results of our study? Altogether, 11,220 COVIDENCE UK participants had valid pre-vaccination antibody test results. So a big thank you to all of you who went through the inconvenience and discomfort of doing a finger prick test and sending it off to us. Of these, 84.2% yielded negative results and 15.8% yielded positive results. So first we asked the question, among all people with a valid pre-vaccination antibody test result, what are the risk factors for having antibodies to SARS-CoV-2? Secondly, in the subset of people who had a positive antibody test result, what are the factors that influence the levels of antibody in their sample? So to address the first question, we looked at risk factors for having antibodies to SARS-CoV-2, and we identified 5 of these. The strongest risk factor was being a frontline healthcare worker. This was associated with an 86% increased risk of having antibodies to SARS-CoV-2 compared to somebody doing another job. The second risk factor we identified was being of South Asian ancestry. This was associated with a 65% increased risk of SARS-CoV-2 antibodies, and this was independent of any other potential confounding factors. The third factor that we identified was a higher alcohol intake. So people who on average drank more than 15 units of alcohol per week had a 26% increased risk of SARS-CoV-2 antibodies compared to those who didn't drink alcohol regularly. Fourthly, those who were overweight were at increased risk of having antibodies to SARS-CoV-2, a 24% increased risk. And finally, people who travelled outside the UK since February 2020 had a 22% increased risk of having antibodies to SARS-CoV-2 compared to those who'd not travelled outside the UK. We also identified a protective factor against antibody positivity, namely gentle exercise. So light exercise, that is walking, or other exercise that doesn't significantly raise the heartbeat or make one breathless, was associated with a 20% decreased risk of having an antibody to SARS-CoV-2. So we then went on to look at the subset of people who had a positive antibody test result, and we asked what are the factors that influence antibody levels. We identified 6 such factors. First of all, being a frontline healthcare worker or having travelled outside the UK. Both of these were associated not just with a higher risk of having antibodies, but also if you had antibodies, they're associated with higher levels of antibody. Secondly, taking a regular multivitamin pill or being a woman as compared with being a man, both of these factors were associated with having higher antibody levels among those who had evidence of antibodies against SARS-CoV-2. And thirdly, again, among people who are already positive for SARS-CoV-2, being overweight or being of South Asian ethnic origin were both associated with having higher antibody levels. Now you'll see that I've grouped these 6 factors into 3 groups, and that's because our thinking is that they may influence antibody levels perhaps by different routes. Frontline healthcare work and travel might influence higher antibody levels by representing more intense exposure to index cases. Taking vitamins or being female might influence antibody levels because these factors might be associated with an immune system that's better at making antibodies. We know, for example, that women tend to be less susceptible to infectious diseases than men, and that they have higher levels of what's called Th2 immunity, which is associated with making antibodies more efficiently in response to infectious pathogens. The third set of factors, being overweight and being of South ethnic origin, might be related to more severe disease. We've shown previously that people who are overweight or people of South Asian ethnic origin are at higher risk of requiring hospital, and it may be that disease severity being worse in these people may be associated with having higher antibody levels. Of course, the $64 million question relates to how antibody levels, when we measure them, predict risk of infection in the future. And to answer that question, we will continue to use the data which are continuing to contribute in the monthly online questionnaires, which captures new episodes of COVID-19. We link those back to your antibody test result, and that will allow us to identify perhaps an antibody threshold that might predict protection against COVID-19 down the line. So what are the take-home messages from the results of this study? Well, first, we've identified several risk factors for SARS-CoV-2 infection. Some of these are already recognised, such as occupation in healthcare or foreign travel, but some of them are new and haven't, to my knowledge, been previously reported. These include high alcohol intake and lack of exercise. Some, admittedly, are fixed. There's not much we can do about our gender or our ethnic origin, but others are modifiable, and I would highlight three in particular: higher alcohol intake, being overweight, and the protective effects of light exercise. These are all things which we can modify to reduce our risk of succumbing to SARS-CoV-2 infection and COVID-19. And so I think that this presentation hopefully demonstrates that the data that we've generated through COVIDENCE UK have identified modifiable risk factors which can inform people's lifestyle choices to reduce their risk of getting SARS-CoV-2 infection and COVID-19. So before closing, I just want to thank a number of people who played a key role in generating this research: Mohammed Talay, David Joliffe, Hayley Holt and Shaif Shaheen from Queen Mary University of London, and Alex Richter and Shan Fastini from University of Birmingham, in whose lab the antibody results were generated. I'd also like to thank Bart's Charity for funding this research. And finally, a big thank you to all of you for contributing all the questionnaire data and the blood spots, without which none of this research would have been possible. Thank you, and until next month, goodbye.